2013 Physician Quality Reporting System Group Practice Reporting Option. Group Practice Measures Overview, Program Year 2013. In this presentation, we will review the 2013 GPRO reporting methods, the 2013 PQRS GPRO measures through either the Registry or Web Interface reporting methods, CMS measures and selection of measures for PQRS, resources, and a registration reminder. This presentation will cover the PQRS Group Practice Reporting option. To participate in GPRO via the Medicare Shared Savings Program, the Pioneer ACO program, or CPC initiative, please consult the respective program requirements. Review of reporting options. PQRS GPROs have a choice between two reporting methods for 2013, Registry and GPRO Web Interface. Both have a reporting period from January 1st, 2013 through December 31st, 2013, and both have a submission period in the first quarter of 2014. The CMS Calculated Administrative Claims option can only be used for purposes of avoiding the 2015 PQRS payment adjustment. It cannot be used for purposes of earning the 2013 PQRS incentive and does not require the submission of data by group practices. This option will not be covered in the following slides. For groups between 2 and 24 eligible professionals, the reporting methods available to you are Registry and Administrative Claims. For groups between 25 and 99 eligible professionals, or 100 or more eligible professionals, the reporting methods are Registry, Administrative Claims, and GPRO Web Interface. The Administrative Claims reporting method can only be used for purposes of avoiding the 2015 PQRS payment adjustment. It cannot be used for purposes of earning the 2013 PQRS incentive. 2013 PQRS GPRO measures. GPRO reporting via Registry. Registry reporting is the only option for groups of 2 through 24 eligible professionals. The Registry provides the patient sampling to CMS, and you must report at least 3 measures for the group with a minimum of 80% of Medicare Part B fee-for-service patients qualifying for the measure. Measures with a 0% performance rate will not be counted. The 2013 Physician Quality Reporting System Claims/Registry Measures Specifications Manual is to be used for this method of reporting and can be found on the Measures Codes page of the CMS PQRS website at this link. The 2013 measure specifications include codes and reporting instructions for PQRS claims and registry-based reporting. A list of measures available for registry reporting can be found in the 2013 Physician Quality Reporting System Measures list. To select a registry vendor, refer to the 2013 Participating Registry Vendors list on the Registry Reporting page of the CMS PQRS website. In this example, a sample group has 150 providers, which includes 60 various specialty providers and 90 primary care providers. Altogether, they see 375,000 patients, and they are reporting via the XYZ registry. This checklist shows how to earn the incentive and to avoid the payment adjustment in 2015. Of the 375,000 patients, 82% are Medicare Part B fee-for-service patients. You only need 80%. Of the 375,000 patients, we need at least 3 reportable measures for the entire group. You can use PQRS Measure 30 from only primary care providers, Measure 154 from only primary care providers, or Measure 163 from both primary care providers and specialty providers. What is a registry? A registry is an entity that captures and stores clinically related data and submits on behalf of the providers and groups. This is the only method that provides calculated reporting and performance rates to CMS. The data must be submitted by the registry to CMS via defined XML specifications. Registries utilize the following data collection methods: patient data from either an EHR or paper chart, from submitted Part B claims, provider EHR system, billing records, etc. Providers then submit their data to the registry via a secure web portal. Registries validate the data, format into XML files, and submit to CMS prior to the deadline. Registries will provide specific instructions on how to submit your data. Please work directly with Registry to ensure data is submitted appropriately. A list of 2013 PQRS registries is available on the CMS website at this link. Please note, CMS cannot guarantee that any or all of the listed registries will be successful in providing the required information on behalf of the eligible professionals for the possible payment incentive. This is a screenshot of the Group Practice Reporting option website at cms.gov. There are a total of 203 measures that are available to be reported via a registry. You are able to determine if a measure can be reported via a registry by looking at the far right column called Reporting Option in the 2013 PQRS Measures list. GPRO Reporting via the Web Interface. Users of the GPRO Web Interface include PQRS GPROs and Medicare Shared Savings Program accountable care organizations. CMS will partially pre-populate the sample. The group practice will then populate the remaining data fields via the web interface. More details on the web interface will be provided on a later call. There are 22 measures from 5 disease modules and 2 patient care modules. The 5 disease modules include coronary artery disease, diabetes, heart failure, hypertension, and ischemic vascular disease. The 2 patient care modules include care coordination / patient safety and preventative care. What is a web interface? It is an application that accepts input and provides output by generating web pages which are transmitted via the internet and viewed by the user using a web browser. CMS pre-populates the web interface with a sample of the GPRO's patients, and CMS calculates the reporting and performance rates from this data. For groups between 25 and 99 eligible professionals, the group must report on all measures included in the web interface and populate data fields for the first 218 consecutively ranked and assigned beneficiaries in the order in which they appear in the group sample for each module or patient care measure. If the pool of eligible assigned beneficiaries is less than 218, then you must report on 100% of the assigned beneficiaries. For groups with 100 or more eligible professionals, you must report on all measures included in the web interface and populate data fields for the first 411 consecutively ranked and assigned beneficiaries in the order in which they appear in the group sample for each module or preventive care measure. If the pool of eligible assigned beneficiaries is less than 411, then you must report on 100% of the assigned beneficiaries. You can find more information on the GPRO Web Interface at this link. A list of the 22 2013 PQRS GPRO Web Interface reporting method measures can be found in the 2013 supporting documents and release notes for ACO and PQRS Web Interface users. These supporting documents include coronary artery disease, care, diabetes, heart failure, hypertension, ischemic vascular disease, and preventive care. They also include supporting documentation release notes for both the 2013 ACO and GPRO. This is a screenshot of the GPRO Web Interface site at cms.gov. This slide shows a list of the care measures, coronary artery disease measures, and the first 3 diabetes measures available to you via the web interface. Here are the remaining diabetes measures, heart failure, hypertension, and ischemic vascular disease measures, and the first two preventive care measures. These are the remaining preventive care measures. Selection of measures for PQRS. PQRS measures are selected through a multi-stakeholder process and through rulemaking. The goals are to allow a variety of eligible professionals to report measures for the program during the CMS designated annual period called Call for Measures. Another goal is to align the measures with the National Quality Strategy and 6 measure domains. These domains include care coordination, population and community health, efficiency and cost reduction, safety, person and caregiver-centered experience and outcomes, and clinical quality of care. The goal is to implement measures that fill critical gaps in care and within the 6 domains. We align measures with other CMS programs to meet Medicare goals, including improved healthcare initiatives around chronic conditions and preventive care, the Million Hearts Initiative, and the National Quality Strategy priorities. Based on the call for measures and the National Quality Strategy, CMS sends a list of measures under consideration for the program to a public-private partnership called the Measures Application Partnership. The MAP then reviews the measures under consideration and makes recommendations to CMS regarding the most appropriate measures for CMS programs, taking into consideration factors such as alignment of the measures with those used in private programs. CMS then identifies measures for PQRS inclusion in the annual proposed physician fee schedule rule. CMS seeks public comment on the PQRS measures list for 60 days following the release of the annual PFS rule. The final list of PQRS measures is listed in the annual final PFS rule. Learn more about the Measure Application Partnership at this qualityforum.org link. Slide 27 shows a flow chart of the selection of measures for PQRS, from CMS annual call for measures and the National Quality Strategy through posting in the final rule. CMS seeks to include measures that have undergone a consensus endorsement process whenever possible. Most PQRS measures are NQF endorsed or in process. CMS works closely with measure owners to assure that CMS is following the measure owner's intent for the measure when updating program requirements and measure documentation. The PQRS specifications measures list include information regarding the owner of each measure. Measure owners seek public comment on their measures during the measure development and maintenance process. The measure owner also makes periodic adjustments to the measure based on factors such as updated clinical guidelines, public comment, and measure testing. You can find out more about measure development and the National Quality Forum endorsement process at this qualityforum.org link. These are challenges in measuring performance. Determining indicators of outcomes that reflect national priorities, recognizing that patient outcomes are usually influenced by multiple factors, determining thresholds of satisfactory performance of participating eligible professionals, recognizing that process measures may not always predict outcomes, therefore evaluation of measure being outcome-driven. Creation of measures that fill gaps in medical care provided to Medicare patients and their providers, and development of a measure concept that can be implemented into multiple reporting mechanisms. Resources. PQRS Registry Reporting. Self-nominated GPROs reporting PQRS via Registry should use the 2013 PQRS Measure Specifications Manual for claims and registry reporting of individual measures and not attempt to report with GPRO narrative specifications, as they are only for GPROs reporting via the web interface. The individual specifications can be found at this link. PQRS Web Interface Reporting. Self-nominated GPROs reporting PQRS via the web interface should use the 2013 PQRS Group Practice Reporting option, Web Interface Narrative Measure Specifications, and not attempt to report with individual claims and registry specifications, as they are only for claims and registry reporting. The GPRO Web Interface narrative specifications can be found at this link. You must register to participate as a PQRS GPRO by October 15, 2013 through the registration system. The PQRS registration system can be accessed at this cms.gov link using your IACS user ID and password. If you self-nominated in January 2013, you do not need to register, but you may make changes to your self-nomination selections if you choose. Look for these other 2013 PQRS GPRO webinars on the CMS YouTube site. 2013 PQRS GPRO 101, Parts 1 and 2, 2013 GPRO Reporting Mechanisms, Part 1 and 2, and 2013 GPRO Value-Based Modifier. Please also check the CMS YouTube site for these upcoming webinars: Individuals Authorized Access to the CMS Computer Services, or IACS, and the CAPS Overview. Note that CMS will host live training sessions on GPRO Web Interface reporting following the close of registration. The main GPRO page of the CMS PQRS website is at this link. You can search FAQs for related questions. You can also contact the QualityNet Help Desk Monday through Friday, 7 a.m. through 7 p.m. Central Time, via email at qnetsupport@sdps.org, via phone at 866-288-8912, TTY 1-877-715-6222, or finally via fax at 888-329-7377.